Hi, I'm Dr. Saeed Sadrameli, board certified neurosurgeon and spine specialist in Orlando, Florida. I specialize in minimally invasive spine surgery and endoscopic. Three words I would use to describe Catalyst are easy to use, malleable, and effective. The most impressive aspect of Catalyst to me is how well and quickly it helps the fusion for our patients. An example that comes to mind is a patient of mine that I operated on. And about 8 weeks later, for a different reason, we had a CT of abdomen and pelvis that was available to us. And so we looked at the CT scan and we could see early changes and signs of arthrodesis or fusion across the levels that we operated on 8 weeks ago or 2 months ago. And so that was quite astounding to us. What's most exciting to me with regards to the catalyst are the fact that I don't have to worry about the cellular effect of the allograft. So this is a synthetic product that doesn't have all the side effects or issues that a cellular allograft would have. Secondarily, I think that the fact that I can open the package and use it right away during surgery, and if I have to add more allograft, I don't have to wait 20 minutes of preparation time. That's another exciting aspect of the product. Um, in general, I think that the clinical outcome is very good. So that's all I can say about that. So as far as patient outcome, with regards to Catalyst, when I first started using the product, I started obtaining CT scans at 3 months to evaluate the efficacy of the product with regards to fusion. And to much surprise, I did see early fusion, bony fusion, and arthrodesis evidence on imaging, on CT scan in particular. And so that gave me further assurance that that is actually a product to be used and to be able to get optimal outcome for my surgeries. So that's how I started to use the Catalyst in pretty much all of my minimally invasive interbody surgeries, with cages being packed with the Catalyst, and also if I needed to have any sort of posterolateral fusion, which is where you expose a bunch of bone in the back of the spine and pack it with grafts. I think that's when I started using Catalyst for both the interbody aspect of the surgery as well as the posterior or the posterior fusion. The handling of the Catalyst is one of the aspects of the product that I really love. So when you open the package, it is very malleable. It is malleable yet sturdy. So you actually have very good handling of it, both for packing the intrabody spacers, as well as if you want to perform posterior fusion where you have to pack the gutters with it. I love that I can mix it with bone pretty effectively and it does not lose its consistency. I love that it's ready to use as soon as it's opened up. And that has really been a very positive aspect in my clinical practice in the surgery. So examples of where Catalyst to be specifically effective is probably patients with higher risk of non-union. So smokers or diabetics or patients who've had prior non-union from prior surgery that we're now going to revise them. I have used the Catalyst and I have used the Catalyst exclusively without any BMP or other cellular augmented graft. And the outcome has been very, very good and positive. So those have really changed my clinical practice. I think from the cost standpoint, it really helps the hospital, but we don't have to use BMP on a regular basis for these cases. So I'm very pleased with the outcome. I think the way that Catalyst has helped me tackle challenging cases is the added assurance that I have moving into that particular surgery that if I don't use another product or cellular matrix or cellular allograft, the OssDsign product will allow me, the Catalyst will allow me to perform the surgery and obtain optimal outcome. I also do a lot of minimally invasive surgery with intrabody fusion and percutaneous fixation, where you don't have a sort of a lot of bony surfaces in the back because of the percutaneous fixation aspect of the surgery to be able to pack with graft. And so relying on interbody fusion and gaining fusion through the interbody arthroresis is very, very important for those surgeries. And so I think the Catalyst has proven to be very effective with those surgeries, and that's been good for the patients and my clinical practice. The way I describe my experience to another colleague regarding my clinical experience with Catalyst is, imagine that you're in the middle of surgery, that you want to open a package of allograft that is solid to help you obtain fusion that you need, but it's also ready to use, and it does not have any, if or many contraindications that I know of. I think that's when Catalyst comes to mind, and you've got to give it a try. My advice to a first-time user of Catalyst is really give it a try. I mean, I think beyond that, I'd have no other advice than to just give it a try and see it for yourself. And definitely get a early CT scan after surgery, perhaps 8 to 12 weeks after surgery,